Did you know that 1 in 3 people will develop cancer in their lifetime? That's a staggering statistic. But here's something even more alarming. Millions of cancer cases are diagnosed too late simply because people overlook the warning signs. According to the American Cancer Society, detecting cancer in stage 1 gives you a survival rate of over 90% for many types of cancer. However, waiting until stage 4, that number plummets below 20%. This highlights why recognizing early warning signs and taking action quickly can make the difference between life and death. In this guide, we'll uncover 8 subtle warning signs of cancer that could literally save your life. These aren't the typical well-known symptoms like lumps or extreme weight loss. Instead, these are the quiet signals your body sends before things get serious, signals that most people ignore, dismissing them as minor health issues or everyday discomforts. Persistent bone pain. Bone pain is often overlooked or mistaken for normal aches caused by aging, exercise, or minor injuries. However, cancer-related bone pain has distinct characteristics that set it apart. Unlike soreness from physical activity, cancer-related bone pain worsens over time and doesn't subside with rest. It intensifies at night, often disrupting sleep. It may start as a dull ache, but gradually becomes more severe and constant. Bone pain occurs when cancer originates in or spreads to the bones, disrupting their normal structure and causing significant discomfort. For example, osteosarcoma, a primary bone cancer, typically affects the long bones in the arms and legs. The pain can start subtly, feeling like a sprain or muscle strain, but it gradually escalates. Warning signs to watch for pain that doesn't respond to over-the-counter pain relievers, swelling or tenderness around the affected area. Unexplained fractures, as cancer can weaken bone structure. If you experience persistent bone pain that worsens at night or is accompanied by swelling, consult a healthcare provider immediately. Early detection of bone cancer or metastases significantly improves treatment outcomes. Unexplained eye pain or changes. Your eyes can reveal a lot about your overall health, including potential signs of cancer. Ocular melanoma, while rare, is the most common form of eye cancer in adults. Symptoms often begin subtly, making them easy to overlook. These include blurred vision that persists even with updated glasses, unexplained flashes of light not associated with migraines, and a dark spot on the iris that changes in size or color. People with lighter-colored eyes, fair skin, or prolonged exposure to sunlight are at a higher risk for this condition. Advanced imaging techniques such as ophthalmoscopes can detect ocular melanoma in its early stages. Why regular eye exams are important. Many people skip routine eye exams, especially if they don't need vision correction. However, these checkups are vital for detecting hidden issues like ocular melanoma. Persistent eye pain, changes in vision, or new spots on the iris should never be ignored. Skin rashes that don't fade. Skin changes are often dismissed as minor irritations or allergic reactions. However, certain types of rashes can indicate leukemia, a cancer of the blood-forming tissues. One specific sign is petechiae, tiny red or purple spots that appear when capillaries bleed under the skin. These spots measure 1 to 2 millimeters in size, don't blanch or fade when pressed, and often cluster around pressure points like the ankles or waist. Leukemia reduces the body's ability to produce healthy platelets, which are essential for clotting. Without adequate platelets, even minor bleeding can create visible symptoms like petechiae. Unlike common rashes, leukemia-related spots are persistent and often accompanied by other symptoms such as frequent bruising, unexplained bleeding like nosebleeds or gum bleeding, and general fatigue or weakness. If you notice any of these signs, it's critical to consult a doctor for further evaluation. Dark streaks under your fingernails. Subungual melanoma, a rare but serious form of skin cancer, develops under the nails. Its symptoms are easy to dismiss as nail trauma or fungal infections, but there are key differences to watch for. A dark streak wider than 3 millimeters running vertically along the nail. Variations in color within the streak, such as shades of brown or black, and the streak extending beyond the nail onto the surrounding skin, a condition known as Hutchinson's sign. This type of melanoma is most commonly seen in the thumb or big toe, but it can affect any nail. If you notice any of these changes, seek medical attention immediately. Persistent night sweats. Everyone sweats at night occasionally, whether it's due to a warm room or stress. However, persistent night sweats, the kind that soak your bedding and aren't caused by environmental factors, could indicate lymphoma. Lymphoma-related night sweats are often accompanied by unexplained fever and sudden, significant weight loss. These sweats occur because your body is overproducing inflammatory chemicals as it fights the cancer. While occasional sweating is normal, recurring episodes that leave you drenched should prompt a medical evaluation. Chronic heartburn. Heartburn is common, but when it becomes chronic and unresponsive to medications, it could signal esophageal cancer. How does this happen? Repeated acid reflux damages the lining of the esophagus, leading to a precancerous condition called Barrett's esophagus. Over time, this increases the risk of esophageal adenocarcinoma. Watch for difficulty swallowing or food getting stuck in the throat, unexplained weight loss, and persistent heartburn that doesn't improve with lifestyle changes or medications. If you've been self-medicating for more than 3 weeks without relief, it's time to see a doctor. Jaundice, the yellowing of skin and eyes, is characterized by the yellowing of the skin and whites of the eyes. While it's often associated with liver problems, it can also signal pancreatic or liver cancer. Here's what happens. Tumors in the pancreas or liver can block the bile ducts, preventing bile from being properly processed. This causes a buildup of bilirubin in the bloodstream, leading to visible yellowing of the skin and eyes. Other symptoms that may accompany jaundice include dark urine, pale, clay-colored stools, and itchy skin, often severe. Since pancreatic cancer is difficult to detect early, recognizing jaundice can be a critical step in catching the disease before it advances. Persistent or recurring fever. A fever that lingers or recurs without explanation could be your body's way of signaling blood cancer, such as leukemia or lymphoma. Unlike typical fevers caused by infections, cancer-related fevers follow a cyclic pattern with regular temperature spikes, often occur without obvious signs of infection, and are accompanied by other systemic symptoms like night sweats and weight loss. Cancer-related fevers are caused by the immune system's response to the disease, as well as the cancer itself disrupting normal body processes. If a fever persists beyond 2 weeks, consult your doctor for a thorough evaluation, including blood tests. Why early detection saves lives. Catching cancer early dramatically improves survival rates. Most of the symptoms discussed here don't necessarily mean you have cancer, but ignoring them could delay a diagnosis and limit your treatment options. Remember, it's better to investigate a benign condition than to miss something serious. If you experience any of these signs or symptoms, don't hesitate to seek medical attention. How to lower your risk. Stay informed. Understanding your body and being aware of potential warning signs can make all the difference. Get regular checkups. Routine screenings for common cancers like breast, colon, and skin cancer can help catch problems early. Adopt a healthy lifestyle. A balanced diet, regular exercise, and avoiding smoking or excessive alcohol consumption can reduce your risk of many types of cancer. Listen to your body. Don't ignore changes no matter how small they seem. Cancer is a challenging and often frightening subject, but it's not unbeatable. By staying vigilant, recognizing subtle symptoms, and taking proactive steps, you can protect yourself and your loved ones. If you found this information helpful, consider sharing it with friends and family. Spreading awareness could save a life. Take care of your health, pay attention to your body, and never hesitate to seek medical advice when something feels off. Your health is your most valuable asset. Treat it with care.